Namaskar. I am Dr. Kopal Mithal, a retina specialist from Red City. On the occasion of World Sight Day, 13th October, I would like to make public about preserving their vision and preventing blindness. WHO estimates of 2015 say that 40 million people in the world are blind and more than 240 million are having poor vision. Unfortunately, one-third of these people reside in our country, India. There are a certain group of people who should have regular eye checkups at least once a year and screening of certain eye diseases that can prevent blindness. We are aware currently that 80% of blindness that is happening can be prevented by regular eye checkups. Those who are over 40 years of age, children having early visual symptoms, or having family history of eye diseases, or having loss of vision in the other eye, and especially those who are having diseases like diabetes, blood pressure, high cholesterol and heart diseases should have regular eye checkups. It is important to know that certain diseases like glaucoma, cataract, age-related macular degenerations and retinopathy can have very minimal or no visual symptoms in early course. Thus, screening is the key to prevent blindness from these diseases. I would like to emphasize on 4 groups of people who should have regular eye screenings and eye checkups and can be saved from blindness. The first group and important group is children. Children are an important part of our society. They are the future. Impaired vision or poor vision in a child not only affects the development of the child but the intellect, education and the future career of the child. We all know that a blind child is not something unfortunate but also a social and economic burden for life. The first area that I would like to talk about is premature babies. Babies who are born before time, babies who are kept in nurseries and survive with difficulty. Such babies should have a first screening, especially screening for retinopathy or prematurity within 30 days of their birth, even if they are in the nursery. While any child who is older or is going to school or before that should be given immediate attention if they have even minimal visual symptoms like difficulty in copying their homework from the blackboard when sitting on the backbench, or are noted to be reading from too close or watching television from too close, or having symptoms like frequent watering from the eyes, itching, redness, or when any white spot is noticed inside the eye of the child. Another important symptom is squinting, or what we call bhengapan, which is an indication of an underlying eye disease in the child. If given immediate attention, many of these diseases can be stopped early and the child can be saved from blindness. Then talking about cataract or safed motia, the most common cause of treatable blindness. With the current technology like microphaco surgery or advanced lenses, cataract surgery can be performed earlier, that is before the cataract matures. It is safer and the patient can have such rapid recovery after cataract surgery that the patient can even drive home on the same evening. The symptoms that the person experiences and is indicated of cataract is blurred vision despite using glasses, frequent change of glasses, having too much glare or intolerance to light, especially when driving at night, or seeing double. These are the early symptoms of cataract, and it is time to go for a cataract checkup to your eye specialist. Then talk about a more ominous disease, that is glaucoma or kala motia. This is called the silent thief of sight. This disease in the early time can have no signs or symptoms at all. The patient is not aware, yet when he reaches the doctor, vision loss, too much damage has already happened, and this is unfortunately irreversible. Currently, there is no technology in the world where sight of a patient who has advanced glaucoma can be brought back. So the key again is to have regular and timely screening. Everybody who is 40 years of age, and especially those who are having family history of glaucoma or having any other eye disease, should have a screening for glaucoma. When picked up early, it is so simple to treat and stop this disease. It can be stopped with eye drops, lasers and very simple surgeries. Then talking about area of my specialty interest, that is retinopathies or macular diseases. These diseases are more common in people who are suffering from diabetes, blood pressure, heart diseases or high cholesterol. Also in people aged over 55 years of age. The first step to stop blindness from these diseases is better control of these systemic diseases like diabetes control. So see your diabetes specialist for good control, and the step 2 is timely referral to a retina specialist. That is at least once in a year for all diabetics, and more frequently when the disease is already picked up. The current advances in the field of retina surgery, lasers and availability of various intravitreal injections like anti-VEGF injections, the visual recovery in these retinopathies can be excellent. The only important thing I would like to emphasize is timely checkups. Thus, again I would like to emphasize, screening is the key to preserve your vision and prevent blindness. You can email me at Dr. Kopal, that is drkopal @hotmail.com, for any queries. Thank you.